Thank you for your interest in Vet NeuroJar. Although we do our best to summarize veterinary articles, it does not supplement the actual article, and if you are able to download and review the article yourself, please see the link in the description. This will summarize the article titled, The Effect of MRI-based Screening and Selection on the Prevalence of Syringomyelia in the Dutch and Danish Cavalier King Charles Spaniels. The Cavalier King Charles Spaniel, CKCS, breed has been found to have several abnormalities that can lead to neurological signs, with Chiari-like malformation CM and syringomyelia SM being the most common. Other neurological problems that can occasionally occur include ventriculomegaly, medullary kinking, atlantoaxial problems, myoclonus, medium-chain acyl-CoA dehydrogenase deficiency, and episodic falling. Syringomyelia is said to result from abnormal cerebrospinal fluid flow, hindbrain overcrowding, or the influence of pulses on the subarachnoid spaces. Both CM and SM are prevalent in CKCS, with SM occurring in 46% of CKCS in the United Kingdom and the Netherlands. SM is a late-onset disease, and because a young CKCS may show no symptoms, MRI is a reliable tool for breed selection against the disease. Several other brachycephalic toy breeds, like Chihuahua, Griffon, Affenpinscher, and Pomeranian, also experience CM-SM. Breeders in the Netherlands and Denmark began mandatory scanning of CKCS breeding stock with MRI in 2011 and 2015, respectively, and there are breed recommendations to limit the selection of affected CKCS. This study evaluated the effect of MRI-based selection in breeding on the prevalence of SM in Denmark and the Netherlands screened population of CKCS over the last 2 decades. Results revealed that after MRI screening in the Netherlands, the prevalence of SM decreased from 58.6% to 40.1%. Meanwhile, the prevalence of SM in Denmark has remained relatively stable despite screening, with a current prevalence of 42.6%. There was also a significant decrease in the proportion of SM-affected CKCS used for breeding in the Netherlands, from 17.5% to 4.2%. Denmark showed no significant change in the proportion of SM-affected CKCS used for breeding, remaining stable at around 10%. This study shows that MRI-based selection in breeding has a positive impact on the prevalence of SM in a screened population. The Netherlands' reduction in SM prevalence can be attributed to the decrease in breeding-affected CKCS. However, further studies are required to determine the factors affecting Denmark's stable SM prevalence despite scanning. Material and methods. Purebred CKCS registered in the Netherlands, Belgium, Denmark, and Germany were included in this study. The Cavaliers for Life Foundation provided the pedigree data, which were then checked and combined with information from the Dutch and Danish kennel clubs. A CKCS was included only if it was screened with MRI scans for breeding purposes and evaluated as offspring if at least one parent was screened by MRI. Data analysis was performed in ORN Excel, and CKCSs with incomplete records or double entry but different information were removed. MRI scans obtained according to BVAKC guidelines were used for this study, and all scans of CKCSs born between 1998 and 2021 were utilized. The scans were evaluated using the BVAKC scheme with one important adaptation, and re-evaluated by an ECV onboard certified diplomat using the Osiris Dicom viewer graphical software. SM unaffected CKCS were defined as those with a CCD of 0 mm, while those with a FFC were considered affected with SM. Exclusion criteria included scans obtained not according to official guidelines, and CKCSs with unclear or unknown parental information or repeated ID entries that did not match the information available in the Kennel Club dataset. Logistic regression was performed to investigate the effect of age on the probability of being diagnosed with SM in the total dataset. The prevalence of SM was also calculated by dividing the number of affected CKCSs by the number of screened CKCSs per year of birth. Univariable and multivariable logistic regression models were used to predict the odds ratio for the offspring of being affected by analyzing independent variables, such as age, sex, SM-affected status of the combination of parents, and combination of the SM scan age category of the parents. In this study, purebred CKCSs registered in the Netherlands, Belgium, Denmark, and Germany were screened with MRI scans for breeding purposes. Data analysis was performed in ORN Excel, and MRI scans obtained according to BVAKC guidelines were used for the study. The scans were evaluated using the BVAKC scheme, and SM unaffected CKCS were defined as those with a CCD of 0 mm, while those with FFC were considered affected with SM. Logistic regression was performed to investigate the effect of age on the probability of being diagnosed with SM, and the prevalence of SM was also calculated. Univariable and multivariable logistic regression models were used to predict the odds ratio for the offspring of being affected. Results. Population description. The study included 2,354 Cavalier King Charles Spaniels, CKCS, with MRI results registered in the Netherlands, Belgium, Germany, and Denmark, whose ancestors originated from several European countries. After quality control, 2,125 dogs were available for prevalence analysis, and 2,065 CKCS for pedigree analysis. The majority of the CKCS were females, 1,491, and most were scanned between the ages of 1-3 years, 54.6%. Prevalence of SM and CKCS. Of the 2,125 CKCS screened, 38.3% were affected by syringomyelia SM. The affected CKCS had a foramen magnum width, FFC, of at least 0.5 mm, and the mean FFC for affected CKCS was 2.03 plus or minus 1.47 mm, with a range of 0.5 to 9 mm. According to the BVAKC scheme, 62.7% of affected CKCS would have been graded as SM1 and 37.3% as SM2. The age of the CKCS significantly influenced the odds of being diagnosed with SM, with odds 1.88 and 2.63 times higher for age group B and age group A, respectively, compared to scans made at 1-3 years of age. MRI scan result for CM and some of the CKCS screened, 94.6% were graded as having Chiari-like malformation CM grade 2, with only 4 dogs scored as grade 0 and 111 dogs as grade 1. A glue ear was observed in 11 to 40% of CKCS, with 20% of right tympanic bully and 40% of left tympanic bully being affected. Prevalence of SM in CKCS screened with MRI between 1998 and 2021. The prevalence of SM decreased after the introduction of MRI-based screening, with the last generation, born between 2015 and 2019 having a mean prevalence of 27% compared to 38% for the generation born between 2010 and 2014. Percentage of SM-affected offspring and parental status. The odds ratio for producing affected offspring when breeding a bitch affected with SM compared with breeding from an unaffected bitch was 1.89. while breeding from a sire affected with SM increased the odds ratio to 1.67. The risk of producing affected offspring was significantly lower when using unaffected parents compared with affected parents. SM status of 340 offspring with MRI scan results of both parents. Out of 340 dogs, 154 had 2 SM unaffected parents, while 50 had 2 SM affected parents. The risk of being affected with SM was significantly higher when both parents were affected compared to when both parents were unaffected. The age of offspring when undergoing scanning significantly influenced the odds ratio of SM diagnosis, with an increase of 1 year corresponding to an increase in odds ratio of 1.45. The combination of age categories of the parents did not show significance in the best fit model. This study investigates the impact of MRI scans in reducing the prevalence of canine syringomyelia in the Cavalier King Charles Spaniel (CKCS) breed over a 23-year period. Initially, breeders followed the 2007 grading system that divided dogs into 5 grades, and those below 2.5 years with an FFC of over 2 mm were advised not to breed. After refinement in 2012, the grading was based on 3 age groups as SM worsens over time. For this study, CKCS with a visible FFC on transverse slides were considered affected, and regardless of age, only unaffected older dogs were recommended for breeding. The prevalence of SM reduced from 38% to 27%, a positive outcome. However, the reduction was less than expected, likely because more younger CKCS were used for breeding. A recommendation was made for breeders worldwide to scan their CKCS for MRI at 3 years of age before breeding and exclude all dogs with an FFC of equals 0.5 mm. The study highlights that selective breeding in the CKCS breed could have detrimental effects on genetic diversity. Thus, the breeding software using algorithms is suggested to reduce this risk. The BVAKC scheme allows 7 combinations of 2 affected CKCS, and this study found that only 15% of combinations were between 2 affected CKCS, whereas 46% of combinations were between 2 unaffected CKCS. The study concludes, by recommending 4 measures to reduce the prevalence of SM, refining the grading system to classify CKCS with an FFC of equals 0.5 mm as affected, not breeding with such dogs, using only cirrus that are found to be unaffected after reaching the age of 3 years, and applying the same measure to bitches after reaching the age of 3 years and found to be unaffected. To note, excluding up to 40% of currently used CKCSs from breeding could introduce a genetic bottleneck, and sophisticated breeding software using algorithms is suggested to reduce this risk. To prevent an increase in other diseases in the breed, the study recommends that breeders worldwide scan their CKCS for MRI at 3 years of age before breeding and exclude affected dogs from breeding.